Hello, and thank you for joining our presentation today. Today, we will review a case study found in Appendix C of the ICD-10-CM and ICD-10-PCS Coding Handbook. First, we will overview the case, then determine the appropriate codes for diagnosis and procedures. Through a demonstration, you will understand the pathways used to find the correct codes and any applicable guidelines, instructional notes, and coding clinics. Let's review our case. An inpatient admission, the patient was brought to the hospital emergency department with burning low sternal epigastric pain. While in the ED, she developed respiratory distress and subsequent acute type 1 myocardial infarction with cardiopulmonary arrest. She was resuscitated, and maneuvers involved in this activity included intubation, mechanical ventilation, and defibrillation. Chest X-rays confirmed pulmonary edema and high output congestive heart failure. EKGs confirmed acute subendocardial myocardial infarction in progress. The patient was then admitted and remained on the ventilator for approximately 24 hours. With gradual improvement, she was transferred to another hospital for further workup and treatment. Our discharge diagnoses: acute myocardial infarction, pulmonary edema, congestive heart failure, and cardiopulmonary arrest. For our first diagnosis code, we'll begin our path with infarct, followed by myocardium, and as the case mentioned, it was a non-ST elevation MI, and we end up at code I21.4. Note the diagnosis is included under this code as well as the coding clinics relevant. I'd like to draw attention to the second quarter 2023 located on page 29, the third quarter 2021 located on pages 6 through 7, and fourth quarter of 2018 on pages 68 and 67. As previously mentioned, there are applicable guidelines to code I21.4, and we can find those if we go to the Help tab and select Guidelines. And the guideline we're looking at is the Use Additional Codes from categories I-50 for heart failure to identify the type of heart failure in patients with heart failure. For our second diagnosis code, we will begin with arrest, followed by cardiac, and this was due to a cardiac condition. That brings us to code I46.2, and note the code first, which is code first the underlying cardiac condition, which we have achieved with the previous code I21.4. For our final diagnosis code, we'll begin with failure, followed by heart, and the case did mention it was high output cardiac failure, which brings us to code I50.83. And if you'll recall from our first code, we were directed to document the type of heart failure, which we're doing here. Let's briefly review the procedures mentioned in the case, which mentioned the patient was defibrillated, intubated, and mechanically ventilated for 24 hours. In the following slides, we will review how to code these procedures. Now that we've coded our diagnoses, it's time to code the procedures. So let's click over to our Procedures tab. And we'll begin coding first for the defibrillation. So let's begin with restoration of cardiac, and it'll direct you to single rhythm, which is 5A2204Z, which is our correct code. You could also get to the code another way. You could path by going through the radio buttons. 5A, restoration, cardiac, and then it finishes the last four for you. So there's a few ways to get to these codes. For our second procedure, we'll look at intubation. We'll begin with insertion of device in the trachea. which takes us to the 0BH1 table. And here we have to decide the approach. And in this case, it was an endotracheal intubation, so it's through a natural opening. This is an intraluminal device since it will be remaining in the airway, so we're going to select E. So our final code is 0BH17EZ for intubation. For our final procedure, we'll record the 24 hours of mechanical ventilation. So we can begin this path with performance, followed by respiratory. And it mentioned in the case that this is for approximately 24 hours. So we would select between 24 and 96 hours. So here we arrive at code 5A1945Z. And again, you could get here through the radio buttons as well. Extracorporeal assistance, physiological systems, performance, respiratory, between 24 and 96 hours, ventilation, and no qualifier. And we still end up at 5A1945Z. Now you know how to path for codes for this case found in Appendix C of the AHA Coding Handbook. What you've seen here today can help you find diagnoses and procedures for other cases as well. Remember to watch your instructional notes, look for your guidelines, and note any applicable coding clinics for codes. Thank you for joining today, and we hope you learned about coding for this circulatory system case. If you'd like additional practice, please see Appendix C of the handbook. Thank you.